Hello, friends. This is Dr. Prabir Basu, consultant urologist and a men's health expert. Thank you for joining me, and I will be discussing today a very important concept of endothelial cell dysfunction leading to a sudden cardiac event. Many of us in our childhood days dreamt of driving a Ferrari. Now, just try to visualize that you are going through a trip through our body's vascular highway. Normally it will be a smooth ride and your blood flow through the blood vessels will be on a cruise control, and you can avoid the traffic jams if you consult your doctor regularly and get your blood pressure checked, do your normal routine blood tests including a lipid profile. But the OMG situation happens when the driver is of a normal fitness, doesn't have any disease, has a normal blood pressure and a very normal cholesterol blood reports. He suddenly comes to a halt and his car topples over. This accident is what we know in medical parlance is a sudden cardiac event, and it can occur due to endothelial cell dysfunction. So as you can understand, endothelial cell dysfunction is a very recent concept. And what is endothelial cells, by the way? They are the inner lining of our blood vessels. So if you can conceptualize the blood vessels as a tunnel through which your blood flow is going, the endothelial cells, they are basically the brick and the mortar of the inner lining of this tunnel. If the cells go dysfunctional, they become thick, they don't allow this tunnel, dynamic tunnel, as in case of a blood vessel, to dilate when there's an excessive traffic, say the blood flow during stressful situation. So what happens? The traffic comes to a jam. The blood flow stops suddenly. This is what causes a catastrophe. This is known as a sudden cardiac event due to endothelial cell dysfunction. Now, endothelial cell dysfunction is very important in the fact that most of the patients don't have the characteristic red flags of a cardiac illness like high blood pressure, deranged cholesterol levels. So it's very important to pick up these patients in the very early part of our life. Right? It's a very new concept. There are a lot of researches being going on about the preventive measures. Statin is one of the preventive measures being discussed in medical literature. And I would also want to highlight a few points, is that this endothelial cell dysfunction is associated with three very common male health issues in today's world. One is erectile dysfunction, two is diabetes mellitus, and three is obstructive sleep apnea. Now, let me tell you, these three disorders are occurring in 5 out of 10 male population. I will come to talk about erectile dysfunction in view of this endothelial cell dysfunction. So as you can understand, before a male patient gets ripped in his heart, he gets a kick below his belt. It has been found that the penile arteries are much thinner compared to the normal arteries of our body. So any form of cell wall dysfunction, that is any form of damage to its lining, will actually cause a more severe impact than it causes to other arteries at the same time. In case of penile arteries, it will cause erectile dysfunction, and the person has repeated attempts of failed erection during sex. So he goes on cursing his stressful situation, while on the correspondingly we are missing the important early symptom of atherosclerosis even before the any anatomical changes have developed in his arteries. Now, as I said, it's very important to pick up at the very first instance this disease gets developed. I will be discussing a few important health tips that's very important in this situation, so that you can ward away from the silent assassin. One is, one has to drop the extra kilos, because it has been seen the more thick the belly fat a person has, the more thin his blood vessels will be. Second will be, a person needs to have an adequate amount of omega-3 fatty acids. Now this fish liver oils comes in capsules, which often most of us, even I am very I have gas issues with those capsules. So if you have some issues with the capsules, please go on taking in a healthy diet on fresh fish if you are a non-veg. 3 is avoid trans fat. Now the most important issue is when you go to a grocery store, you pick up a can of a food item you want to buy and just look at the ingredients. If it contains trans fat, just run away from it. 3 is avoid smoking and energy drinks. It may sound very strange that both of them will open your eyes when you feel very tired, but both tobacco and the artificial sweeteners present in these energy drinks will actually go on corresponding closing up down on your arteries. 5th and very important is a regular workout schedule. It has been found that high intensity interval training is much a better option than steady state cardio in increasing your blood flow through your arteries. So this is the discussion. Thanks for staying with me. Hope you like the points I put up, and I will be returning with more such useful micro videos on health tips. So stay fit, keep healthy, and bye bye.